This feature is brought to you by JPH-MP Direct, the companion site of the Journal of Public Health Management and Practice.
This is Christiaan Abildso. Thank you all for joining me on episode 3 of Views from the Front Porch, our podcast series about physical activity in rural America. This week, I'm lucky to be joined by Dr. Jeff Whitfield. He's an epidemiologist with the Physical Activity and Health Branch at the National Center for Chronic Disease Prevention and Health Promotion with the Centers for Disease Control and Prevention. All right, welcome, Dr. Whitfield.
Thank you for having me. Appreciate it.
Awesome. It's awesome to have you. It's a little cold and rainy here in Morgantown, but it looks good there.
Yeah, not too bad here in Atlanta.
So tell us a little bit about yourself and the reasons for your interest specifically in the rural physical activity focus.
Yeah, sure. So I'm actually a former exercise physiologist turned epidemiologist. I started off my career in cardiac rehabilitation, and after a few years of doing that, I wanted to work more at the population level. So my doctoral work was in epidemiology. And then I came to CDC for the Epidemic Intelligence Service Fellowship back in 2013 and just never left. That turned into a full-time job. And now I'm with the Physical Activity and Health Branch, as you said, which is a great spot to be if you're a former exercise physiologist. So yeah. I have a broad interest in the built environment and physical activity. Really, how do the environments in which we live, learn, work, and play shape our behaviors? I find that fascinating, and it's kind of my personal interest as well as my professional interest. I'm a native Texan. I was born and raised in Austin, Texas, and I think that contributes to my interest in rural America. I still have a lot of extended family that live in small towns and rural areas, especially in Northwest Texas. And so I have something of a personal connection to those places, both back home and now here in the Southeast as well. One of our favorite pastimes is getting out of Atlanta and getting out into the countryside. So I also think that rural and small town America has a roadmap to a more active future. And that is that some of the qualities of small town America, things like these Main Street and courthouse-centric developments, a lot of the economic revitalization projects that we see going on around the country in these small towns really rely on physical activity infrastructure, things like sidewalks and crosswalks and safe infrastructure to get people to come to the downtown and stay in the downtown. And, that's a nice way for both locals and tourists to increase their physical activity. It might not be the reason they put that infrastructure in, but we're happy to have it there for any reason. So, yeah.
That's a great point about the economic redevelopment and I guess the downturn creates an opportunity, right, in rural places and reinvent them with a healthy focus. Yeah, that's awesome.
Absolutely.
Yeah, thanks for sharing all that. So most importantly, we're going to start with what is your favorite physical activity?
Well, that's kind of a tough question. I have several. Lately, it's been anything that gets me out of Atlanta and up into the forests of the Blue Ridge Mountains. So
excellent.
I would say hiking, trail running, and mountain biking are probably my top 3 right now. And I wish I had more time to do it, though.
Yeah, understood. Yeah. It's tough making the time for it, right?
It is. It's an all-day adventure.
Yes, it is. So I appreciate that.
Yeah.
So I want to talk a little bit about, as you recall, and I don't think you were co-author on it, but you're definitely part of the process as we started talking about it. In 2016, a few of us wrote a call to action for rural active living that was published by the JPH-MP. The paper we concluded it with a call to action with 8 suggestions. There's been a bunch of work on many of them since then. You and your colleagues have worked on a few of them that I'd like you to talk about, especially, you've done a lot of work recently about walking specifically in national data sets and about kind of rural urban differences in walking and the environments that impact that. So the first one I'd love for you to talk about is ending the practice of treating rural settings as simply less populated urban areas. They're so unique culturally, socially, and environmentally. So you want to talk a little bit about that and how your work addressed that?
Yeah, sure. I think to start with, just to give a little bit of background, One of the main data sets that we're using in this line of work is the 2015 National Health Interview Survey Cancer Control Supplement. So this was the first nationally representative kind of big public health surveillance system that included questions about people's perceptions of the built environment around their homes as it relates to walking and walkability. And so for the first time, we were actually able to apply for permission to take that data into what we call the Research Data Center at CDC. And using some restricted variables, we're able to see which respondents live in urban areas and which respondents live in rural and small town areas. And that uses the census kind of binary classifier. And so we're able to now, for the first time, start to look at which, in a nationally representative data set of rural dwelling adults, which of those perceptions of the built environment are most closely associated with people's walking behaviors. And so we're trying to get away, as you say, from just assuming that the same correlates apply in urban and rural areas, right? As you said, the situations and the circumstances that people find themselves in rural and small town America are drastically different from urban America. And so it's, I think it's a natural extension of that, or an expectation of that, is that the correlates of walking might be different in urban and rural areas. So we're able to look at that now in a nice big data set. So just to give you an idea, we have somewhere around 6,000 adult respondents living in rural areas from all 50 states that we have information on now, which is a really nice resource for the urban active living research community. So what we found was we did a cross-sectional association study looking at the perceptions of the built environment and people's walking behavior, and how did those differ in urban and rural areas. And so interestingly enough, for leisure walking, so when people walk for reasons other than transportation, not related to their job or household maintenance, but in their spare time, in their recreation time, the correlates of walking, the environmental correlates of walking for leisure are the same in urban and rural areas. It's really about having some basic places to go. So a road, sidewalks, paths, or trails was one of our questions, and that was significantly associated with leisure walking in both urban and rural areas. But for destinations, like where do people actually, what places that people perceive as being walkable near their homes are important for predicting that behavior? It was really about relaxing places. So you might imagine in an urban setting, it could be a park or a playground or something along those lines. Whereas in rural areas, that could take a number of forms. It could be just some open areas that are places that people can go and relax and clear their mind, reduce stress. So that was for leisure walking. Now, when we shifted the focus to transportation-related walking, that is walking to get to some place, so kind of purposeful or intentional walking, that's where we started to see differences emerge. So for urban residents, what we found was that any destination near someone's home was related or was associated with transportation walking. Whether it was things for social activities like movies, libraries, or churches, things like restaurants, or basically any destination that you can think about that we have information for was associated with transportation walking in urban residents. But for rural residents, it was a more selected group of destinations, and it really was limited to things like social locations, so movies, libraries, and churches, and then again, places to relax. And this cross-sectional association suggested that there might be differences in purpose for transportation walking in urban versus rural residents. So, for example, what I mean by that is, for an urban resident, walking for transportation, you could easily imagine someone grabbing some shopping bags, walking down the street and hitting a market, or running some errands, things that they need to do near their home that they can get to at walking. Get to by walking. Those types of destinations are probably not close enough to people's residences in urban areas because they're more sprawled. They're more, the population density and the developmental density is lower in rural areas. And so perhaps it is those social interactions that people are walking to, or leisure time activities that people are walking to, right? So they still have to get to that. It gets a little confusing when you're talking about walking to leisure activities, because it is kind of a blend of transportation and leisure walking. But you could imagine someone walking to a local elementary school in a rural area to attend a softball game or something like that. it's probably a difference in purpose because the amenities that are nearby people's homes are different in urban and rural areas. And I think that really speaks to getting at the next steps of that, or is kind of the qualitative work that you have done and others have done in rural areas, and really talking to people in these areas, asking them, what are the important physical activities? What are the purposes for your physical activities and walking? So I think that, we at CDC, we kind of take the big national perspective, and I think it complements some of the work that you and Renee and others have done in kind of getting your boots on the ground in these communities and collecting some qualitative data. Yeah,
we definitely need the big picture, that's for sure.
Yeah,
we need a little bit of both. That's awesome. That's exciting work. I know a lot of us have been interested in it and happy to read it and see it out there. So the next piece I'd love for you to talk about, obviously you're thinking about the ecological models and the different levels that affect individuals. So can you talk about that a little bit and how that has kind of infiltrated your work and how you're using that to develop the rural evidence base?
Yeah, for sure. I mean, sorry, I've got an airplane flying over at the moment. I hope it's not too loud.
You're so urban.
Yeah, we're on a flight path for a private airport over here in the north side of Atlanta. So, most of the work that we do at the Physical Activity and Health Branch and in our division as well, the larger division is focused on nutrition, physical activity, and obesity. But a lot of our work is at the environmental level. So we're looking to have this kind of broad population reach that might only influence small changes on an individual level, but can reach large proportions of the population. So that outer ring of the classic, concentric circles of the social ecological model. So in addition to the work that I was just talking about, the destinations and supports for walking, we've also been able to pull in some information about the barriers, the environmental barriers that people perceive around their home to walking and other physical activities. And again, using the Research Data Center, we were able to stratify those analyses by urban and rural residents. And some of the results there were more or less what you would expect, and that is that loose animals and dogs are a greater concern for rural residents than they are for urban residents. Personal anecdotes of one, when you're riding your bicycle down a country road, you will get chased by dogs every once in a while. Yes, and that is a concern. That's absolutely a valid concern. And we did pick up on significant differences in urban rural for that. Crime is another one. So urban residents perceive crime as a barrier to walking much more frequently, several-fold more frequently than rural residents do. So, that is not a concern of rural residents. They feel from a crime vulnerability standpoint, they report feeling fairly safe. One of the surprising things that we found was that rural residents were actually more likely to report traffic as a barrier to walking than urban residents, which at first we felt it was kind of counterintuitive. You think of an urban area as having much higher traffic volume than a rural area, but we hypothesized that we're seeing that because of a lack of infrastructure in rural areas to adequately separate pedestrians from motor vehicles. So you can imagine walking along a country road. If you're half a mile outside of town and you want to get to town, you might have to walk along the shoulder of a road, right? Rather than having a safe sidewalk that's separated from vehicles. So that's what we think we're seeing there. We're actually, we've proposed some additional questions to kind of dig into that a little bit more because we found it interesting and we wanted to continue to look at it. So I think there's a little bit more to come on that, but looking at being mindful of the fact that outer ring, that environmental ring of the social ecological model can be not just supports, what do people need to feel supported in their physical activities, but also what barriers can we remove? Right. What is inhibiting people's physical activity as well? Yeah, I would assume it's even traffic speed, because there's lower volume, there's higher speed, and as you probably know. But absolutely, yep. So if others are interested, I know we've talked about this before, but if others are interested in looking into the data vault, you want to just talk about the information about how people could do that? Yeah, it is so just a little bit of background, the geographic variables, things like urban and rural residence or state of residence, those are considered protected variables under CDC's data release rules. So The reason for that is we have to be very careful that no one can identify or potentially identify a single respondent from one of our health surveys, just out of confidentiality concerns. And so to gain access to those, we have to apply for access, and then once approved, so we have to specify the exact analyses that we want to do, submit table shells, and once that research proposal is approved, then you can come into the research data center at a CDC facility. So we have some up in the DC area here in Atlanta. I believe there's a program that might allow you to access that from different census research data centers as well, at different federal centers throughout the country. But I think there's some more information on that online, and I'm not 100% sure of the details on that one. But there is a small cost involved for non-CDC researchers. So I think some people have used some grant money in the past to look at some of these questions kind of in an ancillary manner, right? It might be hard to apply for funding with the sole purpose of getting to the research data center, but having some of these analyses to support larger kind of new research initiatives is one possibility that people could look at.
Sure. And we're getting toward the end here on our time, but you know, one thing we've talked about this before, but in the work that we're doing, we're trying to get a decent, you know, an accurate national physical activity prevalence rate for every county in the country, but we just don't have it. And you know, we talk about sedentary time, we have that, you know, inactive at a county level. We just don't have physical activity guideline prevalence, especially in the rural counties where we have to do, you know, small area estimation, other stuff. We encounter that in the paper we're trying to write. Do you have any thoughts on anything happening on that, or is there, you know, anything you could talk about with regard to that?
Yeah, it's tough. I mean, we do have the CDC has what's called a 500 Cities initiative, right? Where, as you mentioned, using small area estimation of the behavioral risk factor surveillance system data, they've been able to generate some tract level estimates of physical activity. But again, that's limited to 500 largest cities in the United States. So we're not talking about truly, you know, small town or rural America. The challenge there is just getting enough sample size to have statistically reliable estimates in these areas that are sparsely populated. And I think it's going to continue to be a problem. I do think that some of the newer estimation methods are good. I think that there are probably some challenges in using those for monitoring change, because you can never be sure if you're monitoring a change in the variable that you're interested in or in the variables that are predicting the variable that you're interested in. So you know, there might be some uses for which that's appropriate, things like targeting interventions or identifying areas that need further study. But as it comes to things like public health surveillance of behaviors, I think that presents some challenges, and we'll have to work through that as a field moving forward. But you know, I don't think there's a magic bullet, unfortunately. You know, there are some proxy measures that we can look at. We're doing a little bit of work right now with the American Community Survey, which is a large annual survey from the Census Bureau of about 3 million households a year, I want to say, or excuse me, 3 million individuals, or it's data on about 3 million individuals a year from a smaller number of households. But there's data for all 50 states. And by combining years of data, you can get information down to the census tract or census block group level. Some of those estimates get a little bit tricky when you get small and you're talking about some rare outcomes. But the variable of interest there is a very specific measure of physical activity, and it's somewhat controversial because it's just the primary mode of commute to work in the past week. And so it's a very specific measure. It doesn't capture a broad range of physical activities. It's one very specific type of physical activity. But it is the one measure for which we have data at a very small geographic scale. So, you know, there could be some use for that as a proxy measure. We have we have a report coming out looking at it at the state level that also mentions some of these smaller estimates that are possible.
Yeah, I appreciate that. We've used that to shock people here in Morgantown that almost 20% of people commute on foot, by bike, or in transit.
Yeah. Well,
which
classic
people are
example.
shocked by. Yeah.
Yeah, a classic example of a college town having a
Right.
high active transportation prevalence. Davis, California is the same way. My hometown of Austin has a fairly high prevalence, especially if you narrow it down to the census tracts around the University of Texas. You'll see a really high prevalence of walking and biking to work.
Yeah. Well, I think we're going to conclude. I really appreciate you making time and all the work you're doing at the CDC on this. It's great to see some national data sets coming out and helping advise our work. So,
happy to do it. Thank you for having me.
Yeah, thanks for being here, Jeff. That's it for session 3 here on Views from the Front and Back Porch. All right.
All right. Take care.
Thank you, Jeff.
This feature is brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about the research presented in this talk, visit us online at jphmpdirect.com.